I am now honored to introduce our first speaker, Dr. Michael Osterholm. Dr. Osterholm is the Director of the Center for Infectious Disease Research and Policy at the University of Minnesota and a member of President-elect Joe Biden's new Coronavirus Advisory Board. Dr. Osterholm has been a specialist in pandemic preparation for decades. He previously served as Minnesota's chief epidemiologist and co-wrote the New York Times best-selling book, Deadliest Enemy, Our War Against Killer Germs. Earlier this week, in recognition of the grave risk that healthcare workers face during COVID-19, he announced the launch of the Frontline Families Fund to support the families of healthcare workers who have lost their lives to COVID-19. We are so grateful he is with us today to share his perspective on the state of COVID-19 and what to expect in the months ahead. Dr. Osterholm?
Well, thank you very much. It's a real honor to be with all of you, and to all of you essential workers and frontline healthcare workers. Thank you on behalf of all of us for what you're doing. This is a difficult time, and the work that you're doing and have been doing and will continue to do is critical to getting through this pandemic. Let me first of all just add a context to this discussion. In 1918, when swine flu, the H1N1 strain, emerged and caused its horrible pandemic that it did back then, the average community was impacted only between 6 to 10 weeks from start to finish, and it was over with. People don't often think about that as it relates to this pandemic, where we're now literally into our 10th, almost 11th month of responding to this. And the challenge is that long-term response need plays in how we think about where we're at, where we're going, is really, really a remarkable, a difficult step to go forward with, because of just the fact that people are tired and people wonder, will this ever get over? Well, let me just start out by adding context also and saying that today is a day of great news. We learned this morning that the Pfizer vaccine, which we'd already heard was 90% effective, actually now is closer to 95%. I'll comment more on that in a moment. But that, like its companion vaccine, the Moderna vaccine, for which the data were shared earlier this week, both not only cover the milder illnesses, preventing cough, fever, and chills, but actually both showed statistical protection against severe disease. This is absolutely great news. And so we have to keep thinking about that there is light at the end of this tunnel. And that is a very, very important message to share out there. It's not going to come overnight. It will still be months before we can realize, many of us, having access to this vaccine. But it's all the more reason why to tell people now's the time that we really have to dig in, do what we can, what we must, to prevent additional transmission to get us to the day of a vaccine. That then gets us to where are we at today? Well, unfortunately, I believe we are at the single greatest public health crisis in the world since the 1918 pandemic. What we're seeing here, particularly in the United States and Europe, is an out-of-control pandemic transmission, what we call exponential growth. Just to remind people, when you think about the numbers of cases we've seen in this country, to add perspective to what's happening, when we were literally house on fire activity back in April, with New York City being the focus of that ground zero, but also in areas like Chicago, Detroit, New Orleans, at that time, the highest number of cases recorded per day were 32,000. Then, based on activities to try to limit transmission, distancing, as some would say, flattening the curve, we got down to about 22,000 cases a day at Memorial Day. And then pandemic fatigue started to set in, particularly in certain areas of the country, areas that had closed down part of their economy, then brought it back. And we watched the case numbers rise to almost 67,500 in that period of mid to late July. Again, particularly in states like Georgia, Florida, Texas, Arizona, and California, efforts were put into place to try to limit contact, to slow down the transmission of the virus from limiting large group sizes, et cetera. And then we got case numbers back down this time to 32,000 cases, roughly around Labor Day. In fact, at that point, you think to yourself, wow, you know, that really is the same as it was at the height back in April. In fact, the cases bottomed out the week after Labor Day at 26,000 cases a day. Today, we're reporting out 161,934 new cases, but we've had days in the past week of over 185,000 cases. Today, we are reporting 1,707 deaths, which is now beginning to approach that of the worst of what we saw in April. These numbers are going to continue to increase substantially. It will only be a matter of time before we hit the 200,000 cases per day mark and go from there, unless we see major changes in the behavior of our citizens throughout the country. At this point, the cases for the next 3 weeks, particularly those requiring hospitalization and those who will be in ICU units, is already in the pipeline. People who are infected today will start manifesting their symptoms in 5 days or so from now. 5 days after that, will be hospitalized, and then potentially several weeks after that before they die in an intensive care unit or hopefully recover. So even if we could shut off all transmission right now at this moment, we would still see this pandemic unfold really unchanged through at least the next 3 weeks. The challenge we have, as you know, is in our healthcare systems. What are we going to be able to do? We are stretched. We are so stretched. I also realize that we are confronting what I call the trifecta of shortages. Basically, number one is workers. We know, and we surely have followed this, and it was mentioned, the Frontline Families Fund that I helped start to help cover expenses and provide support for those families who have lost loved ones who are healthcare workers to COVID-19. We know that right now the limiting factor is not beds, it's people. And the quality of the care that people are going to get in hospitals, patients, is obviously going to be compromised just by the lack of adequate staffing, and that's number one. Number two is PPE. I can tell you we are going to see increasingly major shortages of PPE over the days ahead as we are consuming so much of it trying to provide care to those coming in. Also, something that happened in July here in this country was an increase in cases, but what didn't happen was an increasing number of cases in Europe at that same time. And now Europe is in the same position we're in, and they too are consuming these same goods, the PPE that we want. And so that's even a bigger hit on the PPE availability. The third shortage of the trifecta is that of drugs. Our group has been very actively involved working on the issue of drug shortages for several years. We've identified 40 very critical drugs for the treatment of COVID-19 patients. Not the monoclonal antibodies, et cetera, not those. But those are just everyday needs, such as antibiotics for secondary bacterial infections, propofol, for example, in terms of trying to intubate a patient. And of the 40 critical drugs we need, right now, as of today, 29 are in shortage status, and that number is growing rapidly, not just in terms of total drugs, but also the severity of the shortage. Again, Europe needs those same drugs, and many of them are coming from Asia, India in particular, which has been hit hard itself with COVID and has limited production and shipment of these drugs. So I can anticipate over the upcoming days that between the shortage of healthcare workers, the shortage of PPE, and the shortage of drugs, the challenges will only become more acute. Now, that's hard to hear, but we have to plan for it. We have to be there. And that, I think, is one of the important issues we'll discuss today, is what does this mean? What are the considerations we have to have? And we need a national plan right now for driving down these cases. How are we going to respond? Right now we have 50 governors, many, many large city mayors, all coming up with their own ideas, their own approaches to trying to limit transmission. Will you close a bar at 10 o'clock at night or not? Do you limit sporting activities in high school? What do you do with restaurants and bars if you do more than just close at 10 o'clock at night? I could go on with the list, but the bottom line is we don't have a comprehensive and proactive ongoing program to understand what we're doing. If you look at other countries in Europe, they surely have taken much more extreme measures to try to drive their case numbers down. The good news out of Europe is that The case numbers actually fell 10% yesterday, but they are still overall still quite high in number. The death toll continues to increase there, however, as again, as you know, that severe illness and death are often leading or indicators that come after the cases themselves. So I just want to leave this call here and pass on the baton with the idea that we do have the potential for a future that looks so bright with regard to this virus. But in the meantime, we've got a lot of hard work to do. And we're asking people who are already very tired, people who are already very stressed, people who have given so much in the healthcare area. And now, unfortunately, we have to come back and ask for even more. But at this point, that is what is going to help us get to the end of this pandemic. In the meantime, however, we can all communicate with our friends, our neighbors, our families about why the prevention efforts that we recommend are so important. Bottom line is stop swapping air. Stop swapping air. However you do that, by distancing, masking can help. The bottom line is that that's what we have to do. If you're going to go to bars or restaurants, if you're going to go to weddings and funerals, if you're going to go to church groups, high school athletic events, just know you're putting yourself, you're putting your loved ones, and you're putting the healthcare workers of this country at risk. And so I hope that we all collectively can come together and help stop the transmission in this country, but still knowing even with all of our efforts, we've got some very difficult days ahead. So with that, I'll stop and turn the program back over. Thank you.
Thank you so much for your leadership and commitment to supporting the nation's critical response to COVID-19.